Tension band principle. What is a tension band? Any device placed on the tension side of an eccentrically loaded fracture that converts tensile forces into compressive forces. This conversion of tensile forces into compressive forces is known as the tension band principle. For a tension band to be successfully applied, there are certain prerequisites. There must be a tensile surface, which is usually a convex surface. There must be a compressive surface, which is usually a concave surface. There must be eccentric loading of the fracture. The compression surface must be stable, that is, there should be a lack of comminution and fracture gap on reduction and application of the tension band, and the quality of bone should be good to prevent pull out of the construct. An example of a bone where tension band principle can be applied is the femur, where the anterolateral surface is the tensile surface and the medial surface is the compressive surface. The most important question that is asked in tension band principle is how does a tension band convert tensile forces into compressive forces? So this is explained with the help of an I-beam diagram. So when this I-beam is eccentrically loaded, it produces displacement forces like this with a center of rotation in the compression cortex. Now this creates two surfaces. The opposite side has a tendency of distracting, also known as the tension surface, and there is compression on the near cortex, or known as the compression surface. When a tension band is applied, this counteracts the distracting forces, and now when the eccentric load is applied, the fracture gets uniformly compressed. That is how it converts the tensile forces into compression force. An important thing to note here is that the tension band must not be elastic and must not have any giveaway. That is, it should be pre-stressed. That is why when we apply tension band wire, we have to completely tighten the SS wire so that it can withstand the distracting forces completely. So this diagram shows a femur which has been managed with the tension band principle with a plating on the tension surface. What are the devices that can be used as tension band? SS wire with K wires is the most common device used, also known as tension band wiring. Plates, external fixator, metal cables, and non-absorbable sutures like ethibond can also be used as tension band. Some of the common locations where tension band principles are applied are dorsal side of ulna, greater trochanter, lateral side of femur, acromion, scapular spine, and fibular head. For tension band wiring, the most common locations are patella, medial malleolus, olecranon, and greater tuberosity. Here, there is a recent update by AO in 2023 where they said that these should not be called as tension band wiring and rather referred as cerclage compression wiring. So, why is it so? Certain biomechanical studies have shown that compression wiring with an SS wire and K wires in these locations do not reliably convert distracting or tensile forces into compression, and hence it is not accurate to call them as tension band. While the technique is still useful in simple fractures with a good quality of bone, the name should be changed to cerclage compression wiring. However, they are likely to be referred to as tension band wiring for time to come, as this has been in use for a very long time. What is static tension band versus dynamic tension? A static tension band is when the compression is produced at the time of application and remains fairly constant during movement. An example is medial malleolus. Whereas in a dynamic tension band, the compression force increases with motion. So in a static tension band, the compression remains constant, and in a dynamic compression band, it increases with motion. The examples are patella and olecranon. So this was a discussion on a very important topic of tension band principle. If you like these videos, please consider pressing the like button and subscribe to the channel for further videos. Also suggest topics to be covered in the future videos. Thank you.